Hi, Silver Access members. This is Marina Sidori, Silver Access Program Coordinator, and welcome to the Silver Access Orientation and Health Insurance Literacy. This is a virtual version of our orientation, so this is new. I hope that that this works all from your homes so that you don't have to be in a classroom with other people. I'm just going to give you guys an overview of what to expect from this virtual version of the orientation since we can't do it in person. So you will hear my voice the same way you would as an in-person orientation. I'm going to go through all of the slides. After we complete listening to the slides, there will be a short quiz. You have to answer all of the quiz questions correctly in order for your attendance to be counted. So if you get answers incorrect, you will be able to retake the quiz, and as long as you can answer them and get 100%, then I will mark you in attendance. Let's go ahead and get started. Some of the topics that we're going to cover today, so if you did come to an orientation last year, we are going to start off with a pop quiz. So some of the information is an overview from last year. We are still going to be entering in a raffle, except it's just going to be anybody that opts to take this virtual version of the orientation. Once I get that you have answered all of the quiz questions correctly and your attendance is marked, I will enter your name into a raffle to be picked from random. We're going to go over some information from your health insurance welcome packet. So if you do have those at home, it would be best to pause now and to go and find that. We also will be taking a deeper dive into some additional health insurance information, such as what is an explanation of benefits and some things that you can do to navigate through surprise medical bills. Okay, let's go ahead and get started with the pop quiz. Okay, so for the pop quiz, what we're going to do is we're going to start with the first three terms, and then we're going to go to the next three. So first term is deductible. What is a deductible and what happens once you have met your deductible for the year? Term number two, coinsurance. What is a coinsurance and what word is commonly misconfused with a coinsurance? Tax credit, commonly referred to as APTC for Advanced Premium Tax Credit. What is a tax credit? Who gives out those tax credits? Okay, let's go ahead and review those first three terms. Okay, term number one was deductible. So a deductible is a set amount that you are responsible for paying towards your policy every year. Every person might have a different deductible. It really depends on your income level, and it also depends on your policy. So the deductible is a set amount that you have to meet. Once you have paid out of pocket towards your deductible and you've met that amount for the year, that's when your health insurance begins to take coverage of your policy. So after you have met your deductible, the most common ratio of coverage is 80-20. Some of you that are listening may have a 70-30 policy, which means that your health insurance would then begin to pick up 70% of the bill and you would be responsible for the remaining 30%. That only happens after you have met your deductible for the year. All bills that you would receive before meeting your deductible would be zero coverage from your health insurance, and you would be paying 100% out of pocket for the full cost. Next term is coinsurance. Coinsurance is most commonly confused with the word co-payment, and the reason why is because I think that they both start with co. A coinsurance is not a secondary insurance. Sometimes people also confuse that with coinsurance. So what a coinsurance actually is very similar to what a co-payment is. So it's a portion that you have to pay out of your pocket. What's the difference between co-pay and coinsurance is that a coinsurance is a set percentage. So you would be responsible for 20% of the bill, whereas a co-pay, you would be responsible for a flat dollar amount, which would be $20. Coinsurances are very important to know about, and a lot of people don't know about them until they go up to the pharmacy window, and then they're told that they have to pay 20% of whatever their prescription costs. So the easiest way to know whether you have a co-insurance or a co-pay is to look and see, is there a dollar sign or is there a percentage sign? And always keep a mental note in your head that a percentage of the bill could very much so easily cost way more than a flat dollar amount. Okay, third term, tax credit. Like I said, it's commonly abbreviated as APTC. And these tax credits are given from the federal government. So everybody that's enrolled in Silver Access has Marketplace Plan, which is a federally funded health insurance policy in which they are giving you tax credits to lower your monthly premium. So without those tax credits, your premiums could be upwards towards $1,000, $1,200 a month. So for example, let's say make-believe policy cost retail value $1,200 a month. The government then gives you $1,000 of tax credits, which lowers your monthly premium to just $200 a month. Without those tax credits, your insurance company would be sending you the bill for the full $1,200. When it comes to tax credits, it's important to remember that the marketplace can take away your tax credits. So if they ever reach out to you for documentation of proof of income or proof of identity, it's really important to pay attention to the deadline that they give you so that you do not ever lose your tax credits. All right, let's hop into the into the other three terms for the pop quiz. First term, preventative care service. What are some examples of the preventative care services and how much do they cost clients or patients? Number 5, referral. What is a referral and what kind of health insurance plans do you commonly use referrals? And last but not least, what is a maximum out-of-pocket? And what happens once you have met your maximum out-of-pocket for the year? Okay, so preventative care services. These are services that are 100% free. So they cost you $0 at the doctor's office. You do not pay a copay at the window. And some examples of preventative care services are annual screenings and checkups, counseling to prevent illnesses and diseases and other health problems. So they are all included into your health insurance plans for you to utilize. Some specific examples of these preventative care services is your annual physical. That's free. You should at least be taking advantage of your annual physical once a year to see your doctor, get a good checkup on your health. If you're a woman, you get an annual gynecologist visit. You get free mammograms. For men, you get prostate checks. If you do reference your welcome book from your insurance company, there will be a detailed list of all of the preventative care services that are under your policy. Another example that just came to my head is vaccines for newborns and infants. Those are free. For when you go to the doctor's office, you don't pay a copay, and those are included as a preventative care services as well. Referral. A referral is a written order from your primary care doctor for you to see a specialist or a certain medical service. The most commonly used health insurance policies are HMOs that they use referrals very commonly. So for a referral, you'll always revert back to your primary care physician, talk to them about what's going on, and then they would decide what kind of specialist you would need to see for further treatment. That referral then gets processed by your health insurance company, and then you are able to see that specialist. It's really important for you to follow those specific steps, especially when you have an HMO plan, that you don't just go straight to your specialist. You have to make sure that that referral is processed and that it gets put in through the system with your insurance company first. Okay, and then the last term of our pop quiz is maximum out-of-pocket. This is a term that is very similar to a deductible, as it is another set amount that you have based on your policy, and it is an annual out-of-pocket that you would be paying towards out of your own pocket. So similar towards a deductible, once you have met your out-of-pocket maximum for the year, that's when your coverage would then skip from whether it's a 80-20 or a 70-30. Once you've met your maximum annual out-of-pocket, then your insurance goes to 100% coverage. So that is the most that you would pay in a worst-case scenario for the year for your health care. So to give an example, I like to say, let's say that your deductible first was $500. You start using your medical insurance, you go to a couple of doctor's visits, and you get bills. These bills that you're first receiving are fully 100% out of pocket, no coverage from your health insurance. You pay $500 of those bills. Now you have met your deductible for the year. After that, your bills start coming in and you're receiving, only you have to pay 30% of the bill. The insurance is picking up 70% of the bill. That keeps happening until you've met your $1,000 maximum out of pocket for the year. You keep paying those bills, 30% of this bill, 30% of that bill. Now you've paid in total $1,000 out of your pocket for the year, and that is your maximum out of pocket. So then if you continue to use your medical insurance, your insurance company would then pick up 100% of the bill since you have met your maximum annual out-of-pocket amount. Okay, so these are just some terms to review from last year. Please pay close attention to these definitions as they may be some questions on the quiz at the end of this orientation. If we were in person, this would be the time that everyone would fill out their raffle tickets to enter into our raffle. So instead, what we're going to be doing is everybody that attends this virtual orientation and also completes their quiz and gets 100% of the questions correct, I will randomly select one person every month that has attended the virtual orientation, and they will be mailed their gift card in the mail. I am going to take this time to squeeze in a quiz question answer. So one of the questions on the quiz is going to be, what is the color of my car? And you will have to have listened to this slide in order to know the answer to that question. So it's kind of a hidden answer that I'm giving you a freebie on. So the color of my car is black. This is so that I can tell that people are listening to this virtual orientation. So the answer to the quiz question of what color is my car is black. Okay, so to transition into our first activity, what I would recommend everybody to do is to locate their welcome packet from their insurance company. If you are from Blue Cross Blue Shield, they should have mailed you a pretty big book. Comes in a big white envelope, and inside is actually a book with over 100 pages. If you are from Ambetter, they give you a miniature version of a book that kind of unfolds in a bunch of different ways, but it still has all of the information. And if you have Cigna, honestly, I've never seen somebody come to orientation with this booklet, so I'm not quite sure what it entails. But I would assume, based on the example that I have electronically from them, is that it would also be similar to the Blue Cross Blue Shield book. What this welcome book is pretty much just an overview of what your policy details. So it goes through every single price breakdown that you would be responsible for if this were to happen, or if you were to go to the hospital for a fracture, or if you needed to stay in the hospital. It would tell you exactly how much would be your responsibility, what your co-pays would look like, what your co-insurances would look like. And so it's really important to just take a moment to go ahead and find that and to work through the next worksheet using that book. Some of the information might also be found on your health insurance card. Your insurance card does give you a couple of options as to the copays for primary care, or for specialty care, or for urgent care, emergency room care. But what your book would go further into detail about is kind of important for you to just read through. So if we were in person, I would hand out this next form, and I would ask each of you to at least fill out 4 to 5 of these boxes from the My Health Insurance info. What I am going to do is I'm going to send an electronic copy of this form to everybody, included with the orientation link, so that you can read through this at home, fill it out from your computer, print it out, write it down. All of this information is pretty important for you to at least know regarding your plan. I mean, things happen, especially health-wise, when you least expect them. So in order for you to have yourself prepared for the bills that come after a hospital stay or a trip to the emergency room, it's important for you to be aware of what you will be charged. There are plans out there that have $1,000 copay to walk into the emergency room, and people don't know that until they actually go to the emergency room. Some emergency rooms will ask for that copay right there before the services are given to you, and some of them will bill you later. So it really depends on which hospital you're going to and what their policies are. But either way, it's still important for you to familiarize yourself with this book, familiarize yourself with the details of your plan, just in case something does happen to you. You are prepared and you know what to expect from a bill from the hospital. Also in your books, it does go through, I've read through each of the 3 insurance companies' welcome packets, and I familiarized myself with some of the reward programs that they offer. So if you have a Blue Cross Blue Shield policy, some of the reward programs that they offer are, first off, they have an app available for Android or Apple users that you can go to your App Store, download it. Some of the cool things on the app are that it gives you a visual of your out-of-pocket and your deductible for the year, so it kind of shows you, where you are and how much more you have to pay until you have met those 2 out-of-pockets. It also gives you the option to have a virtual ID card. So if you forget your wallet at home, or maybe you just left your ID, your insurance card in the car, and you have your kids, you can just pull it up on your phone to check in at your doctor's office. One of the cool reward programs through Blue Cross is called Blue 365, and myself being a Blue Cross Blue Shield policyholder, I had no idea that this even existed. So what this is a discount program for Blue Cross Blue Shield policyholders, and all you have to do is go online to their website and create an account using your email address. It doesn't cost you anything, and then what you would be able to do is take advantage of a bunch of discounts at name brand stores. So for example, you could get 20% off of Fitbit devices or Garmin devices, 20% off at the Reebok store, 30% off the Skechers store. They have an incentive for Jenny Craig enrollment, so I think it was 3 months free, and $120 off your first order. And the Nutrisystem, they offer a bunch of really cool recipe books and some discounts on their blenders and other appliances that they offer. So it was probably 8 to 9 pages of a bunch of discounts through websites or through the actual stores. So if you want to take advantage of a good discount, go ahead and head over to the Blue Cross Blue Shield website and sign yourself up over for the Blue 365. And then another program that they offer is called Well on Target. This is a fitness program incentive that they offer through the Blue Cross Blue Shield site, again, for Blue Cross Blue Shield policyholders. And signing up for this one's not free. So there's a $25 monthly fee with Well on Target, but if you do sign up for it, you get access to over 10,000 fitness locations. So if you're looking for a new gym membership, or maybe you don't know what gym you want to enroll in, maybe you travel a lot for work, so you don't want to be locked into one gym membership where it might not be located where you're traveling to, maybe this is a good option for you because there's a bunch of different locations that you can go to. What's really cool about this is that there's no annual commitment. So a lot of the times with those gym memberships, they try to lock you in for a year or 2 years, and if you don't use it, you have to pay these crazy early termination fees and things like that. So this is just a month-to-month $25 payment to their Well on Target program, and you get access to a bunch of gym locations. So these are some pretty cool Blue Cross Blue Shield incentives that they have for their members. So if you weren't aware of them, definitely head over to their website and take a look at what they have to offer. For my Ambetter members, they also have a reward program called My Health Pays. This one's pretty unique in itself, where Ambetter offers incentives for points, and these points will then be loaded and translated into into cash on a Visa gift card that they mail you. So for instance, one of the incentives that they have is that if you complete your Ambetter Wellbeing Survey during the first 90 days of your membership, you get 500 points. If you go to your primary care physician and you complete your annual physical or your wellness exam, that's another 500 points. 250 points to receive your annual flu vaccination, and what this going on with the coronavirus, flu vaccine is probably a really good idea to take advantage of, and that's 250 points. Now, I'm not quite sure what the exact ratio is from points to dollars, but there was a member that came to an orientation before who said that he took advantage of this program and saved up all of his points, and when he looked up, he had over $300 on his visa that he could use for, things regarding his health care, his co-pays at the pharmacy, doctor's bills. So these are all of the rewards that are loaded onto that card are monitored by Ambetter, so they would be able to determine where you cannot use those funds. But on their website, it does say that you could use it for a lot of different things. So if you are Ambetter Rewards program and you're not taking advantage of the My Health Pays, definitely either give your insurance company a call or head over to the Ambetter website to get yourself signed up today. Okay, so the next activity that we're going to do is called, we're going to take a look at what an explanation of benefits is. So a lot of the times members of insurance companies will receive these explanation of benefits and might not be too sure as to why they're receiving this, what it means, if it's a bill or if it's not a bill. So we're just going to take a closer look at what exactly an explanation of benefits is and break it down, section by section and what each part of it means. So the top portion of your explanation of benefits, of course, it's going to be addressed to you. So you want to make sure that it's your name, your date of birth, your member ID that matches the member ID on your insurance card. Section 2 is the claim summary. So it gets broken down into A, B, C, and D. A is your total charges of whatever medical service that you received. B and C are both the discounts that you'd be receiving from your insurance company, and D is what you would be responsible for paying. So the difference of what the cost of the medical service costs, and then the difference between what your health insurance is covering and what they're not covering, which would be your responsibility to pay. Down at the bottom, you have section 3, which is a summary of deductibles and maximum out-of-pocket. So with this claim being processed, it kind of gives you a visual of where you would stand after the claim is processed with your deductible and your maximum out-of-pockets for the year. So if you had a $5,000 maximum out-of-pocket for the year, this example would be showing you that after this claim is processed, you'd be at $1,802.35. It also gives you the breakdown whether it's for your family's deductible or for your individual deductible, same thing with your maximum out-of-pocket, individual versus family. So it just gives you a good update as to where you are with your out-of-pockets. And then at the bottom, it gives you a helpful information section where it would just tell you important information about your coverage, different tips to lower your healthcare costs, and ways to improve your overall health. So, for example, this one's explaining a little bit more about how they listed your member ID. It do that it hides the first 5 digits for your privacy. So they just want you to know, more details about how something was written on the explanation of benefits so that you can clearly understand. On the back side of this, it gives you your claim details. So Section 3 of this would give you the procedure code. So you want to make sure that you actually did receive the service that's listed here. And Section F would be your claim number. So if you ever needed to call your insurance company questions regarding this claim, you would need to reference that claim number so that they could pull that up. And then again, on the claim details, it gives you the overview of your total charges and the discounts with your health insurance and what would be your responsibility amount for this claim. So it's important for you to kind of have some sort of an idea as to how to read through an explanation of benefits. I will be including another flyer PDF form of some helpful hints on how to read through an explanation of benefits with this link to the orientation. So if you ever run across this in the mail and you forget what I'm saying in this orientation, you can pull out that sheet and kind of review it so that you can walk through your explanation of benefits and understand what exactly you're looking at. Okay, an interesting fact that I came across as I was preparing the research for this presentation. Have you ever wondered where the money is going that you're paying for your monthly premium, or the money that Silver Access is helping you pay? So I ran across this blog on the Blue Cross Blue Shield website, and they kind of broke it down dollar by dollar as to where all the money for the premiums go. So out of every dollar, 38 cents of it goes to the hospitals that you could utilize with your insurance. 26 cents of every dollar goes towards the physicians, the nurses, the CNAs that you would be able to utilize with your health insurance. 15 cents of every dollar goes to the pharmaceutical side of that, so the drug cost, pharmaceutical companies. 11 cents of every dollar goes to other healthcare services, and the remaining 10 cents of every dollar goes to other related expenses. So to summarize, every dollar that you're spending towards your monthly premium, 90 cents of it goes towards directly to the care that you would be receiving with your health insurance, and the other 10 cents goes to operating services of the health insurance company. So just some interesting information that I've never actually ran across, something that's come across my mind a couple of times, but never actually seen any research to prove what happens to premiums. So if you ever were wondering, here's the information. If you wanted to read more, the whole article is listed on the Blue Cross Blue Shield blog site, so feel free to head over to their website to check that out. Nightmares of medical bills. I know that I am not the only one that's received a medical bill and panicked and worried as to how I was going to be able to pay this in addition to other life expenses. So this actually is happening to a lot of people more and more throughout the United States as the cost of medical care keeps going up and up, and the cost that people are being paid for working for their jobs or day-to-day life is not increasing at the same rate. So there are two nonprofits in the United States that teamed up together. One of them is called Kaiser Health News, and another is called NPR, which is a national radio podcast station that talks a lot about the health world in the United States. And so they teamed up together to create a program called Bill of the Month. And Bill of the Month is an investigative series in which they dissect and explain surprise medical bills, these bills that they're receiving from people all over the world, or at least in the United States, are unexplainably expensive, and the patients don't understand why they were billed so much for such a simple medical procedure. So far, since they started this about 2 years ago, they've received over 2,000 outrageous medical bills from across the country, and each month, one bill is selected to be thoroughly investigated. As they investigate the bill, they then publicize a national report regarding it, and oftentimes the bill that they are investigating, gets resolved after the story is published. So the next slide that we're gonna watch is a video of one of the representatives from Kaiser Health, and she's just explaining a little bit more about what Bill of the Month is and some of the stories that they've come across and why Bill of the Month is important to a lot of health insurance policyholders. So what I did was I selected 2 of the bills of the month to review, to give you just an example of kind of the bills that these clients were receiving and how Bill of the Month helped their situation. So the bill of the month from October was Janet Winston, and she received a $48,000 bill for allergy skin testing. Something so simple like allergy skin testing should not cost $48,000. After her bill was contested of the legitimacy of the $48,000 charge, Winston's 10%, it says copay, but we know that when it's a percentage, it's a co-insurance, right? Her co-insurance was cut down in half to about $1,562. So from a $48,000 bill, because this was nationally publicized, they fixed it, and she was only responsible for paying $1,562. Still kind of a hefty bill to pay, but a lot less than almost $50,000. So the takeaway that Bill of the Month wants you to learn from Janet's situation is that when a bill seems a bit inflated, go online and look up what Medicare or other private insurers in your area would pay for that same medical procedure. Use that information to contest the size of the bill. Also, when a doctor warns that a test might be quote-unquote expensive, ask specifically how much that actually costs. Never let the term expensive float around, especially when it comes to healthcare costs, because that could mean $1,000 or it could mean $50,000, especially when it comes to minor tests. Also, it's a good idea to make sure that when you're going for testing that you're very specific about what exactly is being tested, so that when they collect your specimens, whether it's blood or whatever they're taking a look at, that they send it to the lab for specifically what you are asking them for. So let's go ahead and take a look at what the next bill of the month is. The next one was from December, and this one is when Sarah Witter got charged twice for a surgery and surgical hardware after the metal plate that had been screwed into her fractured leg months earlier broke and needed to be replaced. So Sarah went on a skiing trip, and during her skiing trip, she injured her leg, in which she fractured her bone. She went to the hospital to get surgery to repair that fractured bone, and in her surgery they had to place a metal plate to make sure that the bone grew back correctly. Typical procedure for a broken fractured leg. Well, a couple months later, that plate that was put into her leg to heal her bone properly fell out of place and needed to be replaced. So she went back to the hospital where her procedure was done, and they attempted to bill her twice for the exact same procedure when in fact the second round was not her fault or not her doing. So the resolution from Bill of the Month was after her story was published and her insurer in the hospital conferred, Witter received a refund of $6,358. And the takeaway they want you to learn from Sarah Witter's situation is while warranties are the norm when you purchase a car, when you purchase a brand new TV, they're not normal to ask for when you're going for a procedure for medical care. Patients are asked to pay again when something goes wrong. So some hospitals are beginning to offer warranties for elective procedures such as hip replacements, but when they don't offer those warranties, you should ask questions about having to protest for having to pay twice for the same medical procedure. Also, it's a good idea to enlist in the company's HR department to fight the fight that you're going to have to be put up against to dispute any of these charges. So another cool thing that Bill of the Month offers on their website are tips to navigate through surprise medical bills. It's, like I said, happening more and more often where the bills that are being received from clients throughout the country are more expensive than what they thought they would be. They're not getting enough help to navigate through them. So here are some good tips to navigate through any surprise medical bills. Before making the appointment with your doctor, it's very important to confirm that the hospital and the doctors that you will be receiving are in your network when it comes to your health insurance policy. Choosing to see a doctor that is out of your network is 100% the easiest way for your health insurance company to say, I'm not paying $1 of that bill. So don't be in that situation. Double check, triple check to make sure any providers or any hospitals that you will be using your policy at are within your network. Providers and hospitals can go in and out of networks without having to report that information, so stay on top of it and always double and triple check. It's also important to make sure that any prior authorizations are completed before your visit. Check with your insurance to see if that the services that you need are covered under the covered benefits. Check for copays, and if you have a deductible that you have to meet, you'll know right off the bat that you have to pay your deductible amount before your insurance begins to cover any portion of the bills. Also check with the provider for an all-inclusive estimate and a pricing breakdown. Be sure to understand how the hospital calculates all of its bills so that when you receive your bill, you at least have an estimate to compare it to and understand what you're looking at and how the hospital has calculated its outstanding balance that it would be requesting from you. If your bill seems unreasonable, ask for an itemized statement which is kind of like a list of the expenses from your procedure, where it provides a price that goes with each, step or procedure that happened during your surgery or during whatever medical service that you received. Ask about financial aid or charity programs. Almost all of the hospitals in DuPage County offer charity programs where they ask you to fill out an application, take a look at your living situation and your financial situation, and decide whether or not you qualify for the program, where if you do qualify, the hospital could write off some of the charges to make it more financially sustainable for your situation. In regards to the charity programs, it's very important to not let your bill go into collections and to reach out to a social worker or a financial advisor at the hospital before that happens. Once your bill is sent off to collections, the hospital can't help you. They've already sold off that debt to a collection agency. The collection agency is not willing to help you in any regarding your situation. They really just want to collect your money. Be sure that your medical bills include the correct medical insurer address, policy number, group number. Incorrect information can cause your claim to be rejected by your insurance company. One wrong number in your policy number or your group number can lead to your whole claim being denied. So just make sure you're thoroughly reading through your bill. Also check the price you've been billed and how it compares with other companies in your area. Possible mistakes that can happen on your bill. So when you receive your bill, it's important for you to check for any operating room charges, especially when it comes to anesthesiologists. Your anesthesiologist could be considered an out-of-network provider, in which your insurance company could charge you full price for the cost of your anesthesiologist. If this happens, it's something that is disputable with your insurance company, so keep an eye out for that. Also, if you do request a itemized statement that goes through kind of like a receipt of all of the charges, check for any bundling errors. So when this happens, the bill would use a group code for services that they group together, and then that would have one separate price. And then sometimes what they do, and this is kind of really sneaky and not a lot of people know about this, but what they could do then, so they have the grouped bundle that has a specific price for all of the services, and then what they could do is then individually charge you for those same services that are included in the bundle. So definitely take a look for any duplicate charges. When you receive an itemized statement, if you request it, please know that it is required by the law for a provider to provide an itemized statement. So don't let your doctor's office tell you that there's no such thing as an itemized bill. If it's requested, they have to mail it to you, but they don't off the bat send that out. So it is something that is only sent upon request. Double check to make sure that you received all of the services that are listed, that you were not billed for anything that you did not receive, and of course keep an eye out for any duplicate charges. If you've tried everything and you still feel like you're not being helped, of course revert back to that itemized statement so that you can review all of the charges separately. Go to your hospital, ask to speak with a social worker or financial aid counselor about any financial services or charity programs. Or take a look online at either of these two websites to compare any of the fair pricing of the services that you receive. So one of the websites is healthcarebluebook.com, and the second one is fairhealthconsumer.org. I feel like you would be a good candidate to submit your bill for bill of the month. They are still accepting bills on their website. So what they want you to do is head over to this website at khn.org/send-us-your-medical-bills, and you can submit your bill to bill of the month. They'll ask you to upload copies of your bills and to share your story. If you are selected, you could go forth and hopefully getting a resolution to any of your surprise medical bills. Up our first portion of the health insurance literacy orientation, If you already attended the orientation last year and this is your second time attending an orientation, you can stop the presentation right now and head over to the link for the survey to complete your quiz. Reminder that you have to get 100% on the quiz in order for your attendance to count. You can retake the quiz, and if you need to go back into my presentation and listen to anything that I said, feel free to do so. But like I said, if we were in person right now, I would ask that anybody who has not came to an orientation before, if you're a first-time member of Silver Access, stay for the second portion of this orientation. The second portion, we will follow up with what Silver Access is, how the program works, and all the details of Silver Access. So it's completely up to you. If you want to keep listening, you can, or you can stop the presentation now and take the quiz. Okay, Silver Access members, so if you're still with me, you more than likely are a first-time member of Silver Access, or you just want a refresher of the program information. This is the second portion of the presentation for orientation. So this presentation will just be about Silver Access and more specifically about the marketplace and your health insurance, and also how the Silver Access program is run and how to make sure that you are meeting all of the requirements for the program. So a review of what this presentation is going to consist of, we're going to first start talking about the history of Silver Access, how it was created. We'll take a look at a little information about your health insurance from the marketplace, some important information such as the member requirements, common issues that happen throughout the time that members are enrolled in Silver Access, the re-enrollment process for Silver Access, some common resources for all Silver Access members, and then we'll discuss a second survey that will be sent out for all Silver Access members. The creation of Silver Access. So the Silver Access was created to target the low-income population of people that are enrolled in the Affordable Care Act health insurance. I actually started Silver Access as an intern in college, in which I did a lot of data analysis for the cost of health insurance under the Affordable Care Act and how it was going to impact people with lower incomes. So throughout my research, we were able to present a proposal to the hospitals of DuPage County to hopefully gain funding from them for the program. Right now, Silver Access is funded to serve just over 500 DuPage County residents, and all the members that are enrolled in the program are assisted with up to $150 per member towards their health insurance monthly premium. So Silver Access first year was in 2016. I was able to serve 175 members of DuPage County. The second year, we served 445 members. The third year, 550 members. Last year, we served 610 members, and this year we are projected to serve 665 members. You're probably wondering, wait, didn't she just say that she can only serve 500 people at a time? That is still true. The way that Silver Access works is we do not turn away any applications, so there's no end date as to when you can apply for the program. We are only funded to serve 500 people at one time, so we start a waiting list. And the way the waiting list works is while you're on the waiting list, you continue to make your own premium payments, but as spots open, people that are on the waiting list get the opportunity to be enrolled in the program. Very important that all Silver Access funding comes from the hospitals of DuPage County and other private funders. There is no state or no federal funding for this program. We are a nonprofit program with no state or federal funding. So there's no risk of this program being cut in the middle of the year due to budget costs or any financial reasons. We hope that in the future we'll be able to expand this program. Right now, Silver Access is the only program of DuPage County, actually of the entire state, that offers premium assistance for the Affordable Care Act. So we hope that in the future we'll be able to expand outside of DuPage County and be able to serve even more than what we are already serving for DuPage County. The Health Insurance Marketplace, or healthcare.gov, is where you would shop for your health insurance policies online. It's important that you at least take one annual visit to healthcare.gov, especially during open enrollment time, which is from November 1st through December 15th. So since everybody has marketplace insurance, it's important to know that they can contact you for documentation. Some examples of documentation that they may collect would be proof of income. They want to make sure that the income you reported on your application matches what's going on in real life, so they would like pay stubs or previous year's tax documents, or they also can request proof of identity, so they want to make sure that you are the person that applied for the health insurance benefits. It's really important that if they do contact you to send them documents, that you submit those documents before the deadline that they provide. The marketplace does have the right to withdraw their tax credits that are assisting to keep your premiums low if you do not provide them the documents they've requested. So it's really important to just pay attention to any deadlines that they provide to you to make sure that your tax credits are applied to every billing cycle. All Silver Access members are able to take advantage of benefits being enrolled in the program. One of the benefits is that we offer marketplace insurance and application assistance. So during open enrollment time, myself and another colleague are available in our office to take appointments to help you fill out any marketplace applications as well as Silver Access applications. We also are trained on how to fill out any Medicaid applications, so if you need our assistance with that, we do take appointments. All Silver Access members are taking advantage of $150 of monthly premium assistance for each person that is on their policy. And lastly, we offer health insurance literacy education. So every year we will require all of our members to attend health insurance literacy education sessions, such as our orientation. Health insurance is a topic that a lot of people are expected to just know about, but not a lot of people spend the time to either educate themselves or even have the resource available to them to be educated. So we want to just take the time every year to at least refresh our memories on the most common topics of health insurance, or go over some new topics that might be changing from year to year. Enrollment in Silver Access. Now that you're enrolled in Silver Access, it's important to know that we work with all of the insurance companies that are offered on the marketplace. So when you're selecting your plan the next open enrollment year, you can choose any company that you want as long as your policy is within the Silver level. Being contracted with the insurance companies just means that I at least have one person at each insurance company that I can contact with any questions. I utilize that person at least once a month to complete what we call a monthly verification. So what I do is I gather a list of all of the Silver Access members, and I send that list of members over to the insurance company. They pull each of your accounts and tell me what's going on billing-wise. So I'll be able to know what your outstanding balance is for the month to make sure that your premium was paid the month prior to. I'll be able to see if anything changes on your account. So if you add a person, if your premium changes, if something happens with your tax credits, I will be notified of that situation so that I can share my information with you. After I have completed the monthly verification, I'll use that information to then go ahead and make a payment directly to your insurance company. We do attempt to start the verification process by the second week of every month so that that's completed. And within the third week of every month, the premium payment is sent over to the insurance company electronically, and all of the payments are posted to everyone's account. The premium payment process can take anywhere from 2 to 3 business days, depending on how busy the insurance company is. But once they have posted all of the payments directly to everyone's account, they will notify me, in which I then send out a monthly notification to everybody, letting them know that Silver Access has paid their monthly premium for the month. This notification will come out before the last day of every month so that you can not worry that your premium payment wasn't paid on time. Silver Access will be sure to make sure all premium payments are paid before the due date each month. Some other important information that's not listed on the slide, but it's very important to know, is that while enrolled in Silver Access, you will still continue to receive your health insurance bills every month. Because you are the primary account holder, they legally have to send that bill to you each month. What I tell all Silver Access members is to thoroughly read through their bills every month, make sure that there's no duplicate charges, that the premium was paid the month before, but be sure not to make any payments to your insurance company while you are enrolled in our program. If you do make an insurance payment directly to your insurance company and Silver Access also makes a payment that same month, wait for my notification for the following month that we have paid your Silver Access premium, and then you can request a refund from your insurance company. If there are credits on your account, unfortunately, the insurance companies don't just issue a refund. You have to contact them to request the refund. So if you ever need any assistance with that process, just give me a call and I'll walk you through the process for that. Membership requirements. All Silver Access members are required to meet 4 requirements in order to stay enrolled in Silver Access and also to be eligible to return the following year. Number 1, all Silver Access members must pay their premium directly to their insurance company. So for most members that are enrolling during open enrollment time, you have to pay January's premium. Silver Access does not make any premium payments during the month of January. Requirement number 2, all members must sign and date and return their member responsibility acknowledgement form. This form is the last page of your welcome packet, so if you have never seen a welcome packet, you probably have never seen your member responsibility form either, but it is a requirement, so I will be contacting people as we are getting close to the end of March as to who has not signed that form. I'll send an electronic version for you to sign and email back to me, but it is a requirement for that to be filled out in order for you to stay enrolled. Requirement number 3, you need to set up a payment plan or pay off your full balance with the Silver Access program. Upon approval into the program, you are notified as to what your outstanding balance is. We have sent out emails regarding how to set up payment plans, and all of the instructions were listed so that you can make a smooth transaction to either set up a payment plan or to pay off your balance in full. If you still need assistance with that, please contact our office. Requirement number 4, all members are required to attend 1 orientation session every year. So this orientation session that you listen to before the Silver Access one is something that's going to happen every year. Usually it's an in-person orientation where I actually get the chance to meet all of the members and you guys can ask me any questions in person. So this virtual version is the first time we're doing this, but every year you will have to attend this orientation. Your member responsibility acknowledgement form looks like this. So like I said, it's the last page of your welcome packet. And really, by signing this form, you are acknowledging the fact that if you do have an outstanding balance, that you're acknowledging what that outstanding balance is, and also that Silver Access is offering payment plans to make it easier to afford. By signing the form, you are acknowledging that you are financially obligated to set up a payment plan or pay your balance off in full by the due date listed on the top paragraph. This form also gives you the opportunity to decline your enrollment in Silver Access. People change their minds and sometimes they, opt to not be enrolled in the program. So by selecting the decline box, I will remove you from the program and give your spot to somebody that's waiting on the waiting list. The number 1 question that most Silver Access members have is in regards to any financial obligation, of course. So the way that if you owe Silver Access any amount that it's broken down, usually it comes from one of 2 things. First part would be a member contribution. What is a member contribution? So all Silver Access members that are enrolled in this program are responsible for a small portion of their health insurance costs during the time that they are enrolled. The reason why we've created this member contribution is because we believe in promotion of self-efficiency. Silver Access was not created with the intention of making health insurance free, but to lower and help people be able to afford the monthly cost of health insurance premiums. So we break down the member contribution into 3 different categories. All members of Silver Access will either be responsible for paying 1 month of their premium, 2 months of their premium, or 3 months of their premium. Depending on their household size and their annual household income determines, which category you fall into. In addition to your member contribution, all members whose premium are higher than $150 per member per month would be responsible for the difference. So to give you an example, if your premium for one person cost $200 every month, Silver Access will still pay the full $200 directly to your insurance company every month, but you will be billed that $50 difference that will be due to Silver Access in exchange for making sure your premiums are paid directly in full directly to your insurance company every month. If you do have an outstanding balance with the Silver Access program, we offer payment plans available to all members. Mail-in payment plan, this payment option is there for people who would like to mail checks for payments monthly. What I do is if you contact me to let me know that you would prefer mail-in payment, I will mail you a packet of everything that you'll need for the year. So there will be a breakdown invoice as to when all the payments are due by. It will give you all of the monthly coupons that you would send back with your check, and it will also include all of your prepaid envelopes for the year. So that way you have everything you need for the year, and it's the member's responsibility to make sure that every month they mail in a premium payment for their amount of their monthly payment plan. The second option, and I would agree that this is the most popular option for most Silver Access members, is an automatic electronic payment plan. You can either set this up on our website, or we can do it over the phone as well with a credit or debit card. It is convenient and is a secure site, so your financial information is not at risk. You get to choose your due date. So the due date that you initiate the payment plan becomes your due date going forward. There are no interest or late fees added into the payment that you would be setting up. The last payment of all payment plans ends in December, and you would be notified via email regarding how to set up this payment plan. Of course, we do one-time payments as well, so at any time, whether you're on a payment plan or not, you can call in or go on our website to pay off your balance in full with a one-time payment. Okay, if we were in person, I would stop for questions. I will be sending out a survey, so if you do have any questions, please list the questions at the end of the survey, and I'll get back to you regarding those. If you become eligible for other health insurance during the time that you are enrolled in Silver Access, it is important to communicate that with both the marketplace and me. So if you become eligible for Medicaid, probably means you had a drop in your income. Right now with the current situation regarding closing of a lot of employers, this might be happening to more and more people where their income is decreasing. If your income decreases below 138% of the federal poverty level, you would be eligible for Medicaid. As long as you are not a legal permanent resident and haven't been here for more than 5 years, you would then be eligible. If you become eligible for Medicaid, it is very important that you cancel your marketplace coverage. You cannot have Medicaid and the marketplace at the same time. If this happens, the marketplace will request that you pay back your tax credits during the time when you file your taxes. If you become eligible for Medicare this year, happy 65th birthday if that's your situation, or if you've been on Social Security disability insurance for 24 months, please contact the office of Silver Access to update that information and make sure that your account is prorated based on when you will be switching over to Medicare. If you need any assistance with your transition of Medicare, please ask, and I can give you the information to a SHIP counselor. A SHIP counselor is pretty much just somebody that is an expert in the field regarding Medicare. They can make sure that your applications are filled in properly, answer any of your questions about any of the parts of Medicare. So if you need any assistance, please let me know. Again, if you become eligible for Medicare, it is important that you cancel the marketplace coverage, as you cannot have marketplace and Medicare at the same time. If you become eligible for insurance from your employer, if your job changes or your eligibility at your job changes for insurance, you must report that change to the marketplace. There is a legal law that's put into place where if your employer offers you health insurance and that health insurance plan for the least expensive plan that they offer costs you more than 9.66% of your annual income, it is by law considered to be unaffordable health insurance. And if that is your case, then it is okay for you to have health insurance from the marketplace in replace of your employer insurance. For the most part, employers offer health insurance that are below that guideline so that their employers take advantage of that. So if you have any questions regarding if your employer's insurance is below that guideline, you can contact the marketplace and they will be able to help you fill out a form to make sure that you have the correct insurance put into place. If at any time during the year your address or your income changes, it's very important that you first make those updates directly with the health insurance marketplace, especially when it comes to your income. After you have updated the marketplace with this income or address change, then please contact the Silver Access office. I cannot make any adjustments regarding tax credits, regarding any kind of income changes, so that's why it is important for you to first contact the marketplace. Okay, re-enrollment time. Your first stop for re-enrollment is the marketplace. Open enrollment time for the marketplace starts November 1st and ends December 15th. During this time, you can submit a new application for the following year for your health insurance policy. You can change your policy that you have. You can switch to a different company. You can add dental insurance if you don't already have that. You can update your income and any other family information that has changed from the previous year. At the end of your application is when you would select which plan you're going to go with for the following year. So when you're selecting your plan, you want to make sure that you're selecting the right plan to fit your medical needs. There are options for you to search doctors and search hospitals to make sure that any doctor that you want to keep using is still available under the plan that you're selecting. You can search any prescription coverage to make sure that any medications that you have to take daily are still covered with your new plan for the following year. And most importantly, it is important for you to note any network changes. Hospitals and doctors can change their networks from year to year, so if you like to use a specific hospital, please be sure to, using their tools on the marketplace or healthcare.gov, that you are verifying to make sure that the hospital that you like or the doctors that you like are still in your network. Submitting a new Silver Access application is the second step of re-enrollment. Every year it is a requirement that all Silver Access members submit a new application. Your current enrollment in Silver Access will end in December of 2020, and we will not continue to make premium payments into 2021 without a new application on file. The reason why we have all of our members reapply every year is that your health insurance information can change from year to year. You are able to select new plans. Your premiums will likely increase or decrease depending on the current cost of health insurance. And so in order for us to have the most up-to-date information, a new application is the most easy way possible. If you are interested in being a Silver Access member for 2021, you're going to want to make sure that there are no delinquencies on your Silver Access account currently. You have to be sure to meet all 4 of the requirements. So to review those 4 requirements, number 1, you have to attend the Silver Access orientation. I'm sorry, I'm going to do these out of order. Number 2, you have to make sure to set up a payment plan, make sure that your balance is paid off in full. You have to sign and date your member responsibility form, and you have to make sure that you made your first monthly premium. Any Silver Access member that fails to meet all 4 of those requirements, your application will be denied for 2021. However, you will be able to enroll for 2022. If you ever need any assistance regarding health insurance, the marketplace, your Silver Access application, these are 4 resources for you to take advantage of. My number 1 referral source is the DuPage County Health Department. They have a large team of navigators and certified application counselors available at all of their locations. So when I am not available, all of their application benefits specialists are. They have different locations throughout DuPage County, so they're kind of spread out in based on where you live, they might be the closest place to get help from. Another great partnership that we have is with Worry-Free Community. They are located in Glendale Heights, and what I love about that organization is that they offer languages such as Urdu, Hindi, and Arabic, which are kind of hard to come by in this county. So in regards to health insurance, if that's one of your native languages, they are an awesome resource for you to take advantage of. Our office is always open for questions via email, phone, in-person questions. We do take appointments during open enrollment times to help you through your applications, so we are always here for assistance as well. If you have any questions regarding your health insurance from the marketplace, you can always contact the marketplace directly. They do have a 24-hour, 7-day-a-week open call center that is available for any questions regarding your account. They can take any income updates, address updates right over the phone. You can also go and head over to healthcare.gov, and as long as you know your username and password, you can log into your profile and make any changes online as well. I am going to be sending everybody a survey regarding this orientation. So this is a separate survey than the quiz in order for you to count your attendance. So there will be two separate links, two separate surveys. This one is an overview of the entire orientation and the information that I have provided to you. Your feedback is appreciated. Any constructive criticism only helps to prepare for next year's orientation and how I can make this presentation better. Any information that was missed so that I know exactly what kind of questions you have will only help to make the presentation better for next year. So if you have elected to receive text messages from us, you may receive the survey via text message. If not, it'll be included in the link with the orientation for this virtual orientation. If you need to contact me, this is my contact information. During the time that we are working remotely, you can contact my office phone number at 331-716-7573. All of the office phone calls are directed straight to my cell. Orientation for 2020. This is our virtual orientation, our first time doing this. So thank you so much for listening all the way through. Be sure to take the survey at the end.